Chronic stress can impact both physical and mental health in a variety of ways, ranging from eating and sleep disruptions to greater chances of stroke and brain damage. For more on this, we welcome Leah Doan from ASU's Department of Psychology. Leah, good to have you. Thanks for joining us.
Thanks so much for having me, Ted.
Define chronic stress. What are we talking about here?
So chronic stress is a little different than perhaps what I'm experiencing right now, right? Which we think of as an acute stressor or a stressor that's short-lived. Chronic stress is something that happens over a period of time. So either a repeated experience or perhaps like a traumatic experience, which then someone re-experiences over and over again.
So PTSD plays a part in this.
PTSD could be one outcome of something like chronic stress. Other examples would be something like poverty, or it would be something like racism.
Yes, okay. So you got your chronic stress here. How does it impact the body mentally, physically?
Yeah, so our body is actually really smart. And so in some ways, our body is designed to react to stress. So when we experience a stressor, there's a whole cascade of actions that happen starting in the brain and basically ends up with our body having the resources to be able to deal with that stressor. So that's under what we would think of as an acute stress. When we see chronic stress, what happens is that our body is taxed because it's being asked to respond over and over and over again to that perceived stressor, and it stops reacting in the way that it should.
Well, yeah. And even if the stressor isn't there, correct?
Correct. Right? And there are individual differences in this. So some people will just need a reminder of the stressor. Or for others, it might be something that happens to them every day. High levels of competing demands. So caretaking would be an example of one, right?
Yes.
Whether it's a parent, a partner, a child, the high levels of caretaking is a chronic stressor on the body. The body then becomes used to the stress, and so it stops reacting in the way that it should.
It becomes a new norm.
You got it.
And that's not a good thing.
No, because then our body isn't reacting to garner the resources it needs, and that can lead to what we call wear and tear on the body.
Okay, let's talk about some of the symptoms now that show that the body is suffering from wear and tear. What do you got?
So in the moment when we feel stressed, right, we have those physiological reactions, right? So we start sweating, our heart races. Over time, though, what can happen is that we'll start seeing that we're not fighting disease in the same way, or illnesses, right? So our immune system starts to not react in the way that it should to different types of illnesses that are presented. Or we'll see that we can develop cardiovascular issues over time.
So it's not reacting because it says this is the way it's always been. What do I got to react to? What's going on here?
So it's a cascade of effects, right? So because it's been taxed, it's not reacting in the right way to the stressors, therefore the right types of resources.
Yes.
So whether that's getting energy into our bloodstream to be able to deal with the stressors at hand, that can be really taxing on the body, and it stops providing information back to your brain to shut off that stress response. So it's using those resources.
Impact on things like eating, impact on things like sleeping.
So I study sleep as well. So we know that chronic stress and sleep are very linked. So for example, if we have a stressful day, sometimes we get into bed, and what's the hardest thing to do? To shut it off, right? And so oftentimes we'll have what we call pre-sleep worries. That can lead to poor sleep. However, we also know that poor sleep doesn't give us the right resources that we need to deal with the next day's demands. Even if next day's demands are not stressful, we don't deal with them as well. And we don't have the same types of positivity we might have in terms of engaging with other people if we have poor sleep.
And again, if it's a new norm, you're going through this every single night, every single day.
Correct, yes. And oftentimes it becomes a cycle, right? It becomes cyclical, and we have to intervene to be able to stop that cycle.
Eating disorders, eating disruptions, how does it play a part?
Well, so when we're stressed, one coping mechanism is to eat, right? Or to not eat, right? So some folks react to stress by they actually lose their appetite. Others, in order to cope with stress, actually eat more. So we see that in the short term, these are short-term coping mechanisms. But again, under chronic stress, if it's repeated over time, we then see when it can lead into disorder.
Does chronic stress change the equation such that, let's say you're not all that stressed, you're just a normal you eat too much, you got your problems, A. But if you're under chronic stress and you eat too much, are they the same problems or is it different?
That's a hard question. So I think I would say that it's different under chronic stress, because what happens is chronic stress for many individuals changes how they might deal with the everyday demands that they have. So under chronic stress, our bodies are actually also reacting differently, right, to when we're doing what might be normative for somebody else.
Same thing with sleep?
Yes.
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 And that's that sleep thing. We've talked about strokes and brain damage. That comes into play because of the sleep, mostly?
It's not necessarily because of the sleep. It's linked also to the cardiovascular system, right?
Yes.
So if you think about our first response to stress is related to our cardiovascular system. So it's, again, taxing that, but then linked with poor eating, poor sleep, and lack of physical activity.
Can you have chronic stress and not have eating disruptions and not have sleeping disruptions?
Yes. So this is the big point, is that chronic stress doesn't affect everyone in the same way. So we know that different people have different types of coping mechanisms. Some folks are more resilient than others. And so for some, they may have social support systems or resources available to them where they are able to cope with that chronic stress. A term that's been used is called post-traumatic growth, right? Which is actually learning, right, from those stressors and then using those learned behaviors to engage in the future.
And with that in mind, you've got some ideas here. I think people have ideas. Just like humming and singing and doing that kind of moving around, that helps with chronic stress?
Absolutely, right? So taking a walk, getting outside, relying on your friends, your community, your social support, but exercising gratitude, using cognitive reframing to think about positive situations, but also having some acceptance, right? Having acceptance or using meditation can also help.
Yeah, and real quickly, as far as COVID is concerned, how did that change the dynamics?
So COVID is a really interesting case in that it was almost a collective stress, or what the American Psychological Association calls a collective trauma. It is one that was experienced by everyone, which is rare for us to see something like that. And so what it's led to is what I kind of think of as a vulnerability, right? A vulnerability for our population, which is why we have seen increases in chronic illnesses as well as mental health problems, specifically among, the ages of about 35 to 44.
We're talking about chronic stress here. I got to ask, is it a topsy-turvy question here. Is there any research on too little stress?
Oh, that's a great question. I have not come across research on too little stress, given the types of contexts that we live in now and that access to information about other stresses right at our fingertips all day long. But some would say actually too little would not benefit you. Too little also would be bad for you.
You would think so.
You wouldn't be practicing what you're supposed to do, right? Your body's supposed to exercise.
I gotcha, Quay. Anytime I can get a Department of Psychology gotcha question, I'll go for it.